Hi, Dr. Devi. Good to see you.
Hi. Namaste. Today, I'm so happy that we are starting a new lesson about Panchakarma. So, I welcome all of you for this series of lectures and a new understanding, which plays a very important role in the Ayurvedic treatment. Because whenever we say that somebody is going for Ayurveda treatments or they are going to consult an Ayurvedic physician, most of the time people ask, "Oh, you are going for Panchakarma, or you are going to do or receive Panchakarma, or you are learning Panchakarma," something like that. So, Panchakarma term is very common. So whenever you say you are learning Ayurveda or something about the therapies or treatments, most of the people, the first question for you is, "Oh, you are doing Ayurveda, you are learning Panchakarma. Oh, great!" Something like that, because everybody has a great curiosity towards Panchakarma in Ayurveda. So it gives you a great opportunity to treat people and to understand the people in a better way when you learn Panchakarma. So today's topic is Panchakarma management of joint disorders. So with this lesson, we will go through different joint disorders which comes to the clinic and how a Panchakarma person looks to it and what are the Panchakarmas which is highly beneficial in this type of conditions. So as we all know, this joint disorders is a vast area of interest. So this is just an example how a Panchakarma specialist looks to different diseases, different systems of diseases, and how it is treated well. So joint disorders, when we understand or when we go through the textbooks, when we understand what is the dosha prevalent in it, then we understand all the joint disorders are having vata disturbances. But the degree of influence will be different, or percentage of vata influence is different in different diseases or different stage of the disease. Also, when we look into the Ayurvedic textbooks, then we understand these joint disorders comes in the chapters or in the headings like Vata Vyadhi, Vata Rakta, or Santhigada. All these chapters are giving the treatment aspects of Vata Vyadhi or understanding of Vata Vyadhi. Also, the when we say joint disorders, it also the musculoskeletal conditions, joint problem, all the osteological issues, even autoimmune conditions comes in this category, in the big umbrella of joint disorder. So it is very important to know how Ayurveda looks that disease or what is the perspective of Ayurveda. So most of the time, Ayurveda gives importance of the pathology or the samprapti, how this disease happened, what all are the causative factors, how it started, what is the first sign and symptom presented in the patient's body, then how the progression happens, then what all medicines gives its cure, or how some of the medicines are worsening the condition. So we have to understand all these aspects while understanding a disease. Then we go for the site of lesion, the all the symptoms, what is present in the patient, everything is also considered. But first priority is for samprapti, then site of the lesion. So based on this samprapti, we have to design the treatment plan, then we have to execute it, we have to observe it, we have to find the result of the treatment, like that it follows. So this understanding is very important, and also we have to train ourselves to look the condition of the patient in this manner. Now we go through the joint disorders. I told already the Vata Vyadhi or Vata Rekta, something like that. So what happens to the patient, or how we have to see the patient? So imagine a rheumatoid arthritic condition. What happens is that there will be joint problem. So there will be bone erosions, cartilage loss, synovial fluid is inflamed. All this happens together. Then also we have to understand what is the status of the patient at the moment when he or she is in our consultation room. So we are not treating the patient, or we are not treating the disease, but the patient, the situation at the moment is very, very important. So why I told at the moment or at the present situation is much more important is that even in the heading of Vata Shonida or Vata Rekta, there may be condition called Vata predominant condition, Pitta predominant condition, Kapha predominant condition, say in the same disease. Vata Shonida and Vata Rekta are synonyms, so we use both in sometimes Vata Shonida, sometimes Vata Rekta, something like that. Both are synonyms. So Vata predominant conditions we can generally call as rheumatoid arthritis for a learning purpose. Then the Pitta conditions comes, there will be septic arthritis, gouty arthritis, like that. There the Pitta is more predominant. Also in the frozen conditions like a frozen shoulder or some joint, frozen feeling of some joints, or psoriatic arthritic conditions, then we understand there will be predominance of Kapha. So we have to understand which dosha is more predominant in the condition, in the patient. Also, when we understand the severity of the disease, then we say acute and chronic. The what I say, the kala, how we can say Uttana is superficial in the sense not in the skin, but it is affecting the dhatus like rasa, rekta, something like that, but not to the deeper dhatus. But the Gambhira Vata Rekta or Gambhira Vata Shonida, it is more chronic and it is more deep. It is affecting the Asthi Majja dhatus. Then we know what happens to the joint. These are the symptoms comes to the patient clinic. Patient with pain and swelling in the interphalangeal joints. This is the starting stage of Vata Shonida generally. Then there will be deviation of the joints. So these all are the generally Vata dominant conditions. And when it comes to the Pitta, the presentation is entirely different. There will be more of severe pain, severe tenderness, swelling, redness. These are the symptoms. Then here that person will not allow us to touch or feel. The person feels warmth, tenderness will be more. So immediate care has to be given. Then what Ayurveda will do, we will go through. Alex, I lost the control. All the slides are moving by itself. It's okay. Then next is the gout. Then it is a gouty arthritis. There also Pitta dominance is highly visible. So when we see a patient, when a patient comes in front of us in the clinic, we also have to have a keen observation that what is the presenting complaint, what the patient says, what we are observing, both are important. Because sometimes the patient will not be able to explain all the features. But when we see such a condition of redness or acute infectious conditions, redness, tenderness, etc., we understand, okay, there is a pitta aggravation is there. This condition, there is a gouty arthritic condition, there should be pitta aggravation. We have to understand. Even if the patient explain elaborately or not, We have to, because whatever is the condition of the patient, we should be able to translate into the Ayurvedic understanding, especially in the dosha and guna understanding. Then when it comes to the kapha dominated conditions, generally it will be psoriatic arthritis, there will be skin lesions on the body, there will be itching. Then it comes to this type of skin lesions in the head. Then also it is psoriatic arthritis. It is not only in the rasa dhatu, it is more to the deeper dhatus. So we have to understand it. Then it comes to the chronic stage. There will be joint deviations, muscles will be getting atrophy, it will be deformities like that. Then more, other than the rheumatic arthritis, there will be rheumatic fever also is happening in the joints. Then the symptoms are entirely different. Then the leading symptoms will be more of fever, anorexia, lethargy, joint pain, like that. Then there will not be deformity generally. Then, because today there are a number of joint disorders, I am taking 2 or 3 for this today's session. So I take Vata Shonita, Amavata, and Sandhigata Vata. So this is the third aspect called Sandhigata Vata or osteoarthritis. It is more of a degenerative condition. Then here more of degeneration, so we have to give more treatments for the improvement of the muscles, improvement of the mobility of the joint, etc. Okay, now we see how Ayurveda understand all these conditions. Even though it is only a joint problem, if we want to do Panchakarma, we have to have a complete idea or whole idea of the system, whole body, how it is functioning, what is the status of dosha, what is the status of dhatu, and how the Agni is functioning, what is the status of Srotas, everything we have to think. Then only we can start a Panchakarma. So first, when a patient comes to the clinic, we understand all the basic things like Agni, Ama, the dosha, dhatu, srotas, everything. Because only with the name of the disease, oh, it is rheumatoid arthritis, what is the treatment? We cannot say in one word, because what is the status of Agni? Is the person is able to digest the medicine or the food without producing ama is much more important for us. Sometimes we have to understand, okay, what is the status of dosha? Which dosha is predominant? Is it vata or is it pitta? Then the treatment varies. Also, for the same patient comes first, and if we see there is a lot of ama, we start with some of the medicines to reduce ama. After the ama is completely relieved, we go for the Vatahara treatment. So some patient, for the same person, we have to do 2 different approaches according to the situation. Then we also have to understand which joint is affected. If it is the smaller interphalangeal joints or the knee joint, or it is in the hip joint, according to that, we also has to understand the site of the disease, then we can plan the treatment. It will also be a tool to plan the treatment. Then we also understand the symptoms of disease, which even though if it is Vata Shonita, what is the stage? It is in the Uttana stage or in the Gambhira stage. It is in the Ama stage or in the Nirama stage, like that. So if it is in the Uttana stage, that is not very deep in the dhatus. Sometimes lepana is the application of paste in the affected joint. Abhyanga, that is the oil massage with a specific stroke. Parisheka or the Kayaseka is that pouring of medicated liquid on the patient's body. Or sometimes avagaha, that is dipping that specific area in a very specific medicine for this condition. So when a patient comes, first we have to see there is ama or not. If we suspect ama, we are not supposed to start with abhyanga or oil pouring on the patient's body. There we have to do something which reduces ama and also good for vata. So we have a treatment called Udvartana, which is in which we are applying the dry powder on the patient's body, and we do massage from downward aspect to upward aspect. Generally, most of our treatments are from upper part to down, from up to down. But this is a very specific treatment which is done from the lower part to the upper part. So this is a very safe treatment which reduces ama, which removes the kapha, and which opens the srotasas, so that all the treatments are, all the ama is removed and person feels very comfortable. And in our lesson, we will study this treatment elaborately with a full session. How to do it, when is indicated, when is contraindicated, all these things we will do elaborately. Now I am just telling you this is the treatment which is done in joint disorders or in any other diseases if there is ama or increased kapha. Again, we do another treatment which is also good in ama conditions or kapha conditions, is podikiri or churna pinda sweda. There what we are doing is that we are taking a special medicated powder like kolakulathadi churna or kotajukadi churna. So I'm just giving you some examples. Shadahwadi churna. This type of powders, according to the condition of the patient, then this powder is taken in a cotton cloth. Then it is made warm in a mild warm pan, and it is directly applied on the patient's body like this. In the picture what you see. Don't worry, we will elaborately learn all those things. Then we will see where Shatakhwadi is more suitable, where Kolakulathati is more suitable, why for this patient Kotanjukkadi Churna is selected, not Shatakhwadi, etc. We will elaborately deal with. So we will do this treatment. Why I am telling is that this treatment is even good in ama conditions and kapha conditions, and this removes the ama and it helps to remove the or reduce the kapha, so that whatever vata aggravation is there, we can directly go through that. After this treatment, ama is removed, srotas is cleaned. So the what remains is the vata disease. So then we go for the main treatment. So sometimes it works as a pre-procedure to the main treatment. Then we go for some of the lepas like Nimbapatra lepa, or according to the conditions, lepa is application of paste on the affected joint. Then we will do some parisheka or pouring of the liquid medicine. It may be in the form of kashaya or decoction, or maybe medicated milk, or maybe oil, or sometimes oil with a ghee, according to different condition it is. That is parisheka or kayaseka. Then another treatment is abhyanga. There medicated oil is used for massaging the body. This is kayaseka or parisheka. Here in the left, in the body, two persons are pouring medicated milk, which is very good in conditions of vata and vata pitta association. The same way we can do on the head also with medicated milk. This is very good in conditions where there is severe pain and tenderness. Because if there is a tenderness, you cannot rub the patient's body, you cannot hit the patient's body. Just pouring of this liquid, medicated milk medicated with Deshamula, which is very good to reduce the pain and tenderness. Then the same way we can do pouring or the kaya seka. In Malayalam we say pirichil with medicated oil. This is done in conditions where the vata is the predominant dosha, and we have to be very careful. There should not be any ama or srotorodha. Then pitta predominant conditions, we can use some krita internally like shatahwadi, shatavaryadi, tiktakam, padoladi, etc. Then also the main Panchakarma, we know, I'm just telling about the treatments. The Panchakarma means there are 5 main karmas. They are called Vamana, that is the medicated emesis. Then Virechana, which is medicated purgation. It is entirely different from the normal purgation what we have. And also Vasti, that is we are giving enema and we are expelling the doshas from the body. It may be with oil, then it is called Snehavasti. If it is with the decoction, it is called Kashayavasti. Then here in the Pitta conditions, we have to go for Virechana, which is very effective to reduce the Pitta from the whole system, whole body. Also, we can go for Vasti, that is enema, which is, there are different varieties of Vasti. So one among them is Vasti with the milk. So these are the real strong therapies for the Pitta aggravated conditions. So here when I say Virechana or Vamana like that, it is not giving some medicine immediately making the patient Virechana or making him to go to toilet. So it should be done after the Snehapana. Then the person has to give ghee in a very special manner for 5 days, 7 days with a lot of restrictions and under the guidance of doctor. Then with the special medicines, we induce Virechana, that is, we induce purgation. Then only the expected result of expelling all the unwanted pitta from the body and purification of the body happens. So it is entirely different result from we are taking 1 spoon of castor oil and do Virechana is different. But if the dosha is very strong and the quantity is very high, then only we go for the real Virechana. Otherwise, we give some mild laxatives. So we may, there are different medicines which is Virechana in nature. I'm just giving you some examples like castor oil, Avibhati Churna, Triphala Churna, or Drakshadi Kashaya, Trivarleha, Kalyana Gulam Leha, etc. These all are giving result of purgation. So you can take it 1 day, 1 spoon like that. Next day you have some anulomana, little bit of purgation. So in the Pitta aggravated conditions, again Kshiradhara is effective because it reduces the Ushna of the Pitta because milk is very Shita. Then another treatment called Navarakiri or Shashtikashali Pindasveda, which is done with a very specific rice we call Navara. So this is the medicine is boiled, cooked properly with the herbs. Then it is made a packet in a cotton cloth. Then it is rubbed on the patient's body while dipping in the warm milk. So this is a very unique procedure from Kerala, from southern part of India. So this is highly effective in Pitta aggravated conditions. And this is also nourishing the body, which is very good in conditions where depletion of dhatu happens. So the kapha prominent diseases, we have to go for Vamana. So what we do here is that we do Snehapana for 5 days or 7 days according to the capacity of the patient. Then After 7 days, we do Svedana, that is, we do some fermentation therapy for 2 days. Then the day of Vamana, the emetic emesis, we give them some liquids like milk or some decoction. He has to drink liters of liters, and also the medicine to vomit. Then the patient vomit all the milk and also a lot of mucus or kapha, or which helps to remove the condition or which helps to cure the situation. Then again in kapha conditions, udvartana, what I told you already, is a very good treatment which helps to remove the kapha, also to remove the ama. And also very important thing, this treatment helps to reduce the medas. So many people get affected, get the result of it that they get slim. And also in psoriatic arthritic conditions, we have to do the treatment for arthritis. Also, we have to do, or we have to select the medicines which is good for the skin. So we have to adopt Kushta Chikitsa or the treatment for skin diseases also in the psoriatic arthritic conditions. So we do Shothana, that is purification aspect by Vamana or Virechana, both sometimes, according to the patient. Mostly he is able to do this is very, very important. The inclusion criteria or indications are very much important that we learn slowly in the coming sessions. Because what happens is that when patient comes to the clinic, they always say that I want this treatment, because some of the massage or Kshiradhara, etc. are very soothing to the body. But some of the treatments like Vamana, Virechana, Vasti, the patient will not feel any comfort or very happy when they are receiving the treatment. Rather, the result comes later. So, this type of treatments are for the real diseased conditions, not for the comfort of the patient. But in psoriatic arthritic conditions, we have to do seka, that is parisheka or pouring of the medicated liquid. Then we have to select the kashaya, which is good for the skin, like aragodhadi. Then the gambhira vatarakta, which is very deep in the dhatus, their line of treatment itself is snehana, virechana, or kashayavasti. I told already, these virechana, vamana, vasti, raktamoksha, nasya are the real panchakarma procedures. Then we have to go for the kashayavasti, which is the enema. So when we say vasti, there are two type of vasti. First one is called Anuvasana Vasti, that is done by Snigdha medicines, that is oil. There are some examples like Dhanvantaram Tailam, Madhyeshtyadi Tailam, which are very good to do the Vasti. Second one, Asthapana Vasti or Kashaya Vasti, which is an elaborate one and which helps to expel the doshas from the body. And in that category, there are different varieties of Vasti, which is very strong, which is medium, which is mild. Some will be more good to expel the dosha, some will be giving energy. So there are almost 15-20 vastis we do generally in the clinic according to the condition. But each one is entirely different. And this Kashayavasti is the most important treatment for Vata Shonita. So in the Asthapanavasti, I have given some names like Kshirabasti or Rajayapanavasti, which is reducing the Vata, also nourishing the body, especially in the degenerative conditions. Rajayapanavasti is very effective. Also, this Kaya Seka, what we already told, to reduce the Vata, which has a great role in the deeper dhatus. Then this treatment not only acts as an external therapy, it also acts as a therapy which shamana is balancing or pacifying the disease, sometimes utkleshana which stimulates the kleda from the body that has to be expelled through shodhana. Because in Panchakarma, we are doing different levels of management. First one is shamana, that is reducing the or balancing the symptoms or the disease. And the second one is utkleshana, that we are stimulating the things to get detached from the body and to ready to expel. Then the third one is this itself acts as a shodhana, or it when the doshas are lodged in the dhatus, it mobilizes the doshas, which has to go towards the site of elimination, and it helps to eliminate the dosha. Nothing to worry, I will explain everything elaborately in the lessons, because with the half an hour or 1 hour, explanation is not easy. So we will go through elaborately. Again, Tailadhara, which is very common nowadays, which is also very good in balancing the Vata. Sometimes for some persons, we will not be able to do the Dhara because the person is not able to do not able to lay down in the droni, and the pain may be more severe and the person really needs lot of snigdhata in the head, then we do pichu. And also Navarakiri, what we already told, Shashtikashali Pindaseda, which is reducing the pitta and vata, also nourishing, which is very good in degenerative conditions, especially the doshas are deeply lodged. And also Shashtikashali Lepa, especially people who are very old, where they are not able to withstand this temperature sometimes, then we directly applied this medicine on the patient's body, and we do massage in a very specific rhythmic manner. Then also we do some Swedana therapies, that is, we are doing some treatments which is very Ushna in nature, like making the patient fermentation or sweating. So if it is only in one joint, we can go for like a kadibasti, that is keeping the oil in a place, and it should be kept for a prescribed period of time. Then that it will be good for that joint. Then first, whatever may be the condition of the patient, we have to analyze. Then we have to understand if there is kapha or ama. If there is ama, we have to remove the ama. Then we have to make sure that is there is no ama, no kapha. Then go for the vada treatments like kayaseka or pirichil or whatever. So first we go for lankhana, that is balancing with what we say kapha ama reducing therapies. Then only we go for brahmana, that is nourishing therapy. That means we generally don't go for a therapy which is very nourishing. So first we will make the body to receive this therapy in the best. Then in the amavada condition, that is, there is surely of lot of ama, then like udvartana, like podikiri, another treatment what we do is dhanyamla dhara. Yeah, another treatment which is done in conditions of ama is dhanyamla dhara, and which is we are pouring a liquid called dhanyamla, which is kaphahara and vatahara, and which removes all the ama. Then in the conditions vasti, again some another vastis, which is very effective for shodhana, which cleansing is property is there, which is also good for conditions where there is bit of ama or kapha. It expels all the kapha from the body, because some of the contents are very strong, like gomutra. It helps to expel the doshas from the system. Some of the content is the urine of the cow, gomutra, which is very strong, which helps to clean the system faster, which makes the person expel all the doshas. Then again, in the Sandhigadavada degenerative conditions, we can go for the Snehana and Svedana. Here we have to be very careful because the condition is degenerative. We have to nourish the body. Even if whatever may be the patient's condition when they are present in front of our in front of us in the consultation room, then we have to understand not only the name of the disease, rather we have to understand the status of dosha. If kapha is more, this is the treatment. If pitta is more, this is the treatment. If vata is more, this is the treatment. Now you get an idea why this say for the same patient we are giving different medicines in different conditions, different days. Also, we understand the different medicines to the same patient in different weeks of Panchakarma, or different therapies. First, some days, some therapy, next we change into another one. So there is a series of things we have to undergo. So it is a very beautiful thing. It gives you very drastic results in the patient, and patients will appreciate you very much. And this needs a lot of observation and what I say, the passion towards it. So it is like a game, very intellectual game. One guna is increasing, we are applying this medicine. Another guna is increasing, we understand, and we do some other treatments. Some group of gunas are aggravating, or some group of gunas are declining. According to that, we can do different therapies in different ways, and understand the body, understand the patient, understanding the condition is very essential. This study also helps us to change our attitude from quick fixing to understanding. Now we go for the questions and discussions, but I think there are a lot of questions in the chat. Shonita is Rakta Dhatu. So when Vata associated with Rakta Dhatu, this condition is called, this disease is called Vata Shonita or Vata Rakta. Next question is a very interesting question. Yeah, rheumatoid arthritis, Yogaraja Guglu is good, Mahayogaraja, yes. First, we have to understand the status of dosha. If there is little bit of ama and kapha, Yogaraja Guglu is better. If it is more of vata, Maharasnadi is Kwatha is better. If there is lot of ama, Amritottaram is better. So there are more than 50 medicines we can give in this rheumatoid conditions according after understanding the status of dosha, the dhatu, ama, and srotas. So all are good according to the perfect situation where it has to be placed. So we have to understand which one is more effective to the present situation. Next is what is the specificity and duration of Panchakarma in case of autoimmune diseases? Actually, any disease, not only the autoimmune disease I'm telling now, needs to have a real understanding of the situation of the patient. So sometimes it may be 14 days, sometimes it only 7 days may be needed, sometimes it needs 21 days or something like that. Because if there is ama, first we need some days to remove ama. If there is no ama, we can directly start with the treatment. And according to the strength of the patient, if they need more brahmana, we have to add some more days for doing that. So blindly, we cannot say this is the duration for Panchakarma. Each patient, each situation needs different duration. And especially for autoimmune diseases, it is very difficult to treat. So in my experience, what is observed is that in autoimmune diseases, we have to do Panchakarma repeatedly to get better results. So what is the remedies can be taken for bursitis and synovitis in the knee? Generally, we do some lepa, especially lepa or local dhara with kashaya, which is made up of guduchi, along with some internal medicines. And the next one is many patients after Panchakarma returning from treatment complaining of loss of muscle tone and accordingly an increase in the load on the joints. What could be the associated with? Actually, immediately after Panchakarma, patient feels little tired, looseness of the joints and all. That is because of the person withstand a lot of therapies and body becomes little more soft. After a while, after some days, this tone of muscles and general health will be regained. That is why we are telling immediately after Panchakarma, the person has to rest for some days. And next is what all are the daily habits generally for joint pains and all. If we do Abhyanga as a part of Dinacharya, it is good. And the next question is what Kritam and Thailam in Panchakarma should be used chronic? Generally, in furunculosis, there is pus and all. We generally don't use any oil and krita. Then we use some decoction dhara, especially with the Triphala Kashayam. It helps to remove the pus. Next is question. There is a question about chronic furunculosis, the skin lesions. There is a lot of pus formation in the lesion. So in such conditions, generally we don't apply any oil or krita. Then we can do some parisheka with Triphala Kashaya, which helps to remove the pus. And the second part of it is insulin resistance in type 2 diabetes. Actually, the insulin resistance happens because of Dhatu Agni problem. So first we have to correct the Dhatu Agni with internal medications, and sometimes Udvartana also may be effective, or sometimes Podikiri may be better. That we will finalize really understanding the patient. Next question is, are Virechana Vasti procedure used for viral diseases during fever? No. Next is, I am interested in the issue of reducing high temperature in children. Actually, if we have to really treat such conditions, we have to understand really about the patient, and we have to have a clear knowledge of Panchakarma. Don't apply one for child when he is in a high temperature. So it will come in the elaborate lessons, and we will answer after having a understanding better. Because if we are not really understanding about the cause of the disease, it may lead to complication. Next question, Veda Education will answer. Next is, can you recommend preventive procedures that are aimed at calming Vata during the cold, long Russian winter? Two things we can do there. One is Snehana and one is Svedana. So in the winter, especially when there is a lot of Vata, you have to use internal oils according to the person, and also some type of massages or Svedana therapies, Patrapotali Sveda or Churdapinda Sveda, etc. are also effective. Once a while or once a week, according to the intensity of your winter. Internally, you can use every day. External therapies as much as possible according to your convenience. Next, I didn't get. It may not be a question, I think. Okay, next is, what age Vamana can be used? Yes, for childhood and old age, there are a lot of restrictions for Vamana that we elaborately learn in the chapter of Vamana. Not only for Vamana, most of the treatments have restrictions for small children, and some are very good for children, some are very good for old age, some are restricted for old age. There are a lot of indication and contraindication. Next is, other than pulse diagnosis, how we detect ama by tongue, by skin, also asking the patient about the digestion, asking about the feeling of the patient, how he feels heaviness of the body, etc. There are a lot of aspects. I don't know how much questions we will be able to answer. Still, we will try our level best. But don't worry, we will be continuing these sessions. So anytime you will get the answer. Is it possible to replace Vamana with another method? Generally, if the patient is not indicated for Vamana, we do Virejana to expel the dosha. But the effect is a little bit different. So after the Virejana, we may give some internal medications to remove the remnants of kapha, if any. Did I understand correctly? Udvartana can be used without preliminary oiling. Not necessary to do abhyanga before Udvartana generally, but sometimes we may use abhyanga as a pre-procedure to Udvartana. There is lot of ama, no abhyanga, directly you can do Udvartana. Then second part, podikiri also without preliminary abhyanga, without oil, just hot baths. It can be possible, but only thing is that if we do without abhyanga, chances of getting burning, if the therapist is not equipped well, chances of getting burning may be there. So what we generally do is that we apply a very little of oil on the body, and while selecting that oil, we select some oil which is Ushna and which will not cause ama, like cotton chukadi, then do podikiri. Cotton chukadi, even though it is a oil, it is very Ushna and Tikshna. Shashtikashali lepa, it is absorption done with hot compression. It is not necessary to be for absorption, it not necessary to be hot. Shashtikashali Pindasveda, generally we do with hot, but Shashtikashali Leba we do cold. Next is that if a person who learned Panchakarma want to practice, it is always you have to train under the doctor and understand the situations and make sure you are able to clearly understand the status of dosha, then you can practice. If we treat a really diseased person, we should be very clear. What of what will be studied in the course can be used by an Ayurvedic specialist without. Sorry, I didn't get understand. Sorry, can you?
The question is about what procedures can a person make if they don't have special medical education?
In after the course in Veda education, they are asking, or generally?
I don't know which one is more informative.
Because whenever we learn, when we want to do some therapies, we have to learn that therapies from an Ayurveda specialist who guide you and you can do it. But if you have no idea of having the why it is selected, what is the reason behind it, you cannot do this treatment.
Then what about after the educational course? What knowledge
After the
will we
educational
have?
course, they understand what is done, what should not be done, who is the indicated, who is the contraindicated, then they can do. And also they can get the help from an Ayurvedic expert whenever needed. Okay, next is also told what is the minimum time. That depends upon the patient situation. Also, the next question, if the fingers of head on hands and slightly deformed, is it imbalance of Vata dosha? Yeah, here, if only the finger is affected and it reached to the level of deformity, there is a high change happened to the Vata in the whole system, not only in the finger, the whole system. So there we also have to understand there is swelling, the severity of the pain, etc. Then sometimes we have to go for some of the seka, parisheka, that is pouring of medicated oil, etc. But if deformity happens, we also has to think of preventing that aspect. We may do for Kashaya Vasti, because it is a first sign that Vata is affected, and it is going to affect, maybe chances of getting affected by other joints. So we have to prevent that also with some Vasti. Next is, what is your opinion of doing Panchakarma at home? If you want to do the real Panchakarma like Vamana, Virechana or Vasti, better not to do in the home. Or some Shamana therapies like Churna Pinda Sweda or Kaya Seka, something like that, you may do at home with a proper equipped situation. But the real the real procedures, what can be done at home, is the expanded version of Dinacharya, like application of oil, some Udvartana, proper taking bath, etc., which helps to prevent the disease. I want to elaborate the points a lot, but I think time won't permit me. Is 15 days enough to do Panchakarma? If you need only one Panchakarma like Vamana, 15 days is enough. Or you need some therapies like treating some diseases. For some days we do Udvartana, then we do Parisheka. If that is enough for the severity of the disease, 15 days is enough. And who is contraindicated for Panchakarma? Every session I am going to explain 15 minutes about this, because a set of people are contraindicated for Vamana, another set of people are contraindicated for Virechana, another set of people are contraindicated for Nasya. So each treatment, there are a specific set of indication and contraindication. Next, Shankha Prakshalana, I don't know. I don't do it. Generally, I'm not doing it. And next is the presence of gallstones contraindicated for Panchakarma? Only thing is that if we do some Svedana or that expansion of blood vessels happens, or then there may be chance of mobilization of stone may happen. So you should be careful, that's all. Then hygromas and all, we need to treat very carefully, and it is not one word answer. Next is, when visiting a sauna, I can lose 200 to 300 grams. When visiting a sauna with oiling, weight can reduce by 1 kg at a time. This is highly changing, because which type of sauna you are going, and what is the medicine you are using, what is the oil you are using, and how many minutes you are exposing to the sauna. A lot of things are there to they are all are the decision fact makers. So we need more elaborations in this. During Panchakarma, ghee is drink in increasing order amounts, 3, 4, 5 tablespoons. What is the wisdom of this? Is it possible to drink for longer periods but a fixed volume of oil? Generally, there are, I will explain it elaborately in the Snehapana lesson. So what we do is that there are 2 types of Snehapana. One we do only for maximum 7 days. There we drink oil, 50 ml, next day 100, 150, 200, like that. The final day the person may drink up to 400, or that depends on person. Sometimes it may be 200, but it may be 400. So that is one type of snehapana. There it is used as a purva karma or pre-procedure to vamana and videchana. And that another type of snehapana is called shamana snehapana. That is for some diseases. So every day you take 10 ml of ghee at night going to bed or early morning, like that. That you can do for longer durations, like 1 month, 2 months, like that. The first one only maximum 7 days. 10, yeah, that depends, 10 or 15, not like 100. 5, 10, or 15, like that is the generally what we give. Depends on Agni. How to remove at least some of ama at home? Yes, we can do many things to remove ama at home. So first thing, when you eat, you can reduce oily, unctuous substances, fried items, which is more heavy to digest, that you can avoid from the food if you feel there is ama. Second, you can use more spices in the food. Then again, you feel there is ama, you can do, you can take some internal medications like Trikadu Churna or Panchakarma Churna in the house, along with some warm water just before food, something like that. Or some Irish. That is powder. You can mix with warm water and drink. Also, doing some exercise also reduces ama. Also, you may do some type of udvartana, that is massaging with powder in the house by yourself. That also helps to reduce ama. So I think I have explained it elaborately.
There was also one that specified that furunculosis was without pus, just with skin, superficial skin condition.
So wherever there is inflammation also, we are not doing oil and ghee generally. First, we start with Kashaya Dhara with internal medications. Then according to that, we go for the next levels. Whenever we discuss about some specific cases, more data is needed really to treat. Giving some examples or possibilities, it's okay. It's finished. More questions from anywhere? It's okay.
Yeah, there was only a question that they wanted to see a particular slide. They missed something.
Okay.
I'm trying to looking for that.
Yeah.
A slide before Kijichi. I guess I can try to do that.
Yeah.
So
It's
I
okay.
guess have we covered all of those?
Yes. Then thank you all for the participation and your curiosity to know Panchakarma. Because what I feel is that when after learning Panchakarma or when you start practicing Panchakarma, it gives you a lot of insights and it gives you a lot of ideas to treat patients, and you will be able to give wonderful result to the patients and you feel very satisfied. So try to understand Panchakarma, all the therapies, and many people will get benefit out of it, not only you. So see you all in the lesson starting from the next week, and all some of your questions will get answers by without answering. When you just listening it, there will be a lot of answers for your questions. Thank you, Alexander, for your wonderful translation. See you soon in next month with another lesson.
Thank you very much, Dr. Devi.
Thank you all.
Bye.